Over the past 45 years, we at JB have been known for our solid foundations, unique approaches, and an unwavering commitment to healthcare. Globally, we have been a symbol of trust and reliability. 4,000 plus employees, 40 plus global markets, 20 plus therapeutic categories, 7 world-class manufacturing facilities, have global accreditations and unique technologies. Our consistent good quality medicines and compliance across global markets has made us a trusted partner of choice for leading global MNCs, manufacturing generic products as well as branded formulations. A feather in our cap is our lozenges business, and we are one of the world's top 5 manufacturers of medicated and herbal lozenges. Our lozenges come in a myriad of flavors, shapes and forms, so that our customers get exactly what they want. Our progressive vision for global healthcare made us explore international markets, united with the mission of spreading good health globally. JB, good people for good health.
As I said earlier, cough is one of the most common symptoms encountered in clinical practice. If you're a general practitioner or if you're a general physician, likely that every 4th or 5th patient that you see in your practice will be presenting to you with this symptom. Remember that cough is a very, very important physiological reflex that is aimed to clear the respiratory passage of either any foreign material that has entered inside or any respiratory secretions that have come from the mucosa of the airways. So cough by its very own nature is a very protective reflex. It is something that we should look at it with respect, because one of the first things that come to your mind when you see a patient with cough is, how should I block this cough? I know that this cough is bothering my patient, and therefore my first intent is to stop this cough or to block this cough with some cough suppressant. I think it is very important not to do that, because if you treat a patient with cough with only a cough suppressant, you would likely cause more harm to the patient. And it's important for the physicians to appreciate this. Sometimes the cough doesn't serve any purpose. It only is a marker of something that is going abnormal within the respiratory tract or some of the other organs that are close by. And therefore, we need to find the root cause of the cough and then treat that cause, rather than just treating the patient with any cough suppressants. So how do you go about approaching a patient that has come to your clinic with symptoms of cough? The first thing that you do is you take a good detailed history. Now, this detailed history with specific regard to the cough will give you whether the patient has got a wet or a productive cough, or whether it is a dry or a non-productive cough. It's very simple. The only thing that you need to ask the patient is your cough associated with any phlegm, or is your cough associated with any sputum? If it is associated with phlegm or sputum, then it is categorized as a wet cough or a productive cough. And a wet cough or a productive cough is often very easy to diagnose, because it will tell you that there is some likely an infection that is happening in the respiratory tract. The non-productive or the dry cough is a bit of a challenge, and not very easy to sometimes find the underlying cause of a dry cough. And therefore, many a times you may find that these patients, it takes some time to find the underlying cause. Uh, Very often, it is a diagnostic challenge. So, how do you overcome this diagnostic challenge is what I'm going to cover in the subsequent slides. So, now that we have understood that the patient is categorized into a wet cough or a dry cough, this presentation is only going to cover dry cough because this is the more challenging one. So the causes of dry cough can be categorized into respiratory causes and non-respiratory causes. Obviously, the cough is a respiratory symptom, so there will be more respiratory causes for this dry cough. The most common cause is a post-viral infection of the upper respiratory tract. And this is something that many children, adults, or even the elderly patients might present to you with. The next common cause is a post-nasal drip. So whether you have a viral infection or an allergic nasal rhinitis, if that goes behind the throat, that will cause a post-nasal drip type of a cough. Remember that asthma is a disease that is believed to be mainly presenting with shortness of breath. I do not know what is the literal translation of asthma in your local language, but in India, the meaning of asthma is translated into a word that means breathlessness. Now, while breathlessness is a common symptom presented with associated with asthma, remember that many a times a dry cough could be the only presenting feature of underlying asthma. So it's important to know that because many a times when you make the diagnosis, patients will tell you, but doctor, I don't feel short of breath. How do you know that this is because of asthma? It's important to then explain that many patients of asthma primarily present with a dry cough. It's called a cough variant asthma. Eosinophilic bronchitis is another component or another type of asthma that is associated with allergies. And so that's also another pretty common cause of cough that is dry in nature. If there is any compression of the respiratory tract from within the thorax, such as from the mediastinum, it could be an aortic aneurysm, it could be a mediastinal lymph node, it could be mediastinitis or mediastinal abscess. That can also manifest with a dry cough. Then diseases that surround the lung parenchyma, such as the pleural diseases, whether it be pleural effusion or a pleural type of a pleural thickening or a pleural infection or a pleural malignancy, they can all present as dry cough. And then finally, interstitial fibrosis, which is sometimes caused by viral infections or sometimes caused by bronchiolitis obliterans in response to fungal allergens or an idiopathic variety. That pulmonary fibrosis will also present with dry cough. So these are the common causes of dry cough due to respiratory conditions that you will encounter in your clinical practice. Now, there are non-respiratory causes of dry cough as well. And many a times, these can be more common than the respiratory causes. And we'll cover that one by one. Remember that gastroesophageal reflux is a very common cause of cough. And very often it is not diagnosed or it is wrongly diagnosed. So GERD is an important cause of a dry cough. Then drug-induced cough. For example, angiotensin converting enzyme inhibitor or an ACE inhibitor is a very common cause of a drug-induced dry cough. Very commonly seen in clinical practice, especially those patients who are prescribed this medication by their cardiologist, either for hypertension or for a heart failure, should be considered as one of the underlying causes of a dry cough. Then it could be caused by psychogenic conditions as well, which is not uncommon at all. And then idiopathic, where you have absolutely no idea what is the cause of this dry cough. Now, if you look at the most common triad, or the three most common conditions associated with dry cough, you will see that there are three mentioned over here: post-nasal drip, gastroesophageal reflux disease, and a cough variant asthma. These are the three most common causes of dry cough. And by and large, in your clinic, they would account for about 2/3 of all the chronic cough conditions. The upper airway cough syndrome was earlier called as the post-nasal drip. That term is no longer used now. It is now replaced with the upper airway cough syndrome. Very common cause of a dry cough. And this is usually attributed to the underlying rhinitis or rhinosinusitis. And then the secretions, when they trickle down behind the pharynx, behind the throat, that's where the irritation happens and the dry cough actually gets stimulated. Then you have the dry cough associated with asthma. And as I said earlier, it could be the only manifestation of an underlying asthma condition. So asthma is the second most common cause of a dry cough. And then finally, you have the gastroesophageal reflux disease, which can be seen in between 10% to up to 40% of your patients who have this dry cough associated with a problem associated with the gastrointestinal tract. And we will come to this in detail in the subsequent slides.